I'm 60 years old and quite active, mountain biker, snowboarder, I play ice hockey, so I really try to keep moving in my life. And what brought me here is what probably brings a lot of people, which is I had an earlier injury when I was 28 years old. I broke my tibial plateau and tore my meniscus on my left knee snowboarding. And I had that repaired, had the fracture repaired. As well as the meniscus. And Dr. John Selitsky in Mass General did that for me in 1996, and he did an amazing job. And it's kind of funny because the knee never bothered me again, just until last year. So I do remember, it's funny, that I think he told me when I was like 28, oh, you're gonna probably need a knee replacement when you're like 50. And of course I was like, yeah, whatever, because it felt like a lifetime away, and I was just happy to kind of get back on my feet. So, but it did last till I was almost 60. So thanks a lot, Dr. Selitsky, because that was awesome. So anyway, so last summer, I had no knee problems at all through my active lifetime. And last summer, just mountain biking, I was kind of leaning into a turn in Whistler, and I tore my meniscus, and didn't fall or anything, just basically mileage, because it had been repaired earlier previously. And went to Rebound Sports Medicine in Portland, Oregon, which is the area that I live in. And a great doctor named John Cafferny, he helped me get imaging and kind of guided me through the process. So basically they found that my meniscus was torn, extruded actually, and that I had cartilage damage on the lateral side. And I found out later that that is pretty common after you've had a fracture like I did earlier in my lifetime. So all you younger people out there that have knee problems, that they might come back and, they're always kind of maybe echoing in the background. But overall, again, my knee works perfectly up until that time. So just a mileage thing and time. So through Dr. Cafferny's help, we decided to actually really look into some alternative medicine things before we wanted to go for the knee replacement, because the knee replacement is quite final. And sometimes, I'm no doctor here, by the way, so I highly suggest everybody to do just as much research as you can and ask a lot of questions, because there's definitely different pathways for everybody. And so don't feel bad about asking questions. It's really makes yourself feel better too, that you've looked into every avenue. So for me, what we decided to do was go to the Stedman Clinic in Vail, where I was with Dr. Matthew Preventure. He's an awesome doctor. And we decided to do a orthopedic surgery, arthroscopy, and to see what was going on in there, see if he could do a root procedure to repair the meniscus, and if I could, kind of kick the can down the road and not get the knee replacement until maybe a little later. Also look into the Oates procedure, which is where they take a bit of cartilage from your a healthy area and put it in the areas that your cartilage needs to be repaired. It didn't look that way on the x-ray, but he said, hey, if I go in there, it's the best way is just to look with the cameras. So I got that done in December, and unfortunately couldn't repair the meniscus. It was too far gone, so he just trimmed it. And I was not a candidate, unfortunately, for the Oates procedure. So that kind of set the pathway for getting a knee replacement. The good news is, while I was in there, he said, hey, the medial side looks great. So it's just the lateral side that needs to be repaired. So with that, all I really needed is a uni. They call it a uni knee replacement. So it's one-sided, a lateral side only. And it's a little different. It's a little less complicated than a full knee. It's very similar, but they just picked the one side. And it feels supposedly it feels a little more natural, because they don't take out any of the ligaments during the procedure, nor do they detach the patella tendon. So a little less pain as well, and the rehab is supposed to be a little easier. But it's a very similar operation. So with that, again, through Dr. Caferni, we talked about directions, and I ended up getting it done here with Rebound Sports Medicine with Dr. Todd Boris. And Dr. Boris was just great. He's a specialist with the Mako robot. And again, you guys do your research and look at the so many videos out there, but the robotic assisted surgery is really cool, and it's much more accurate than a standard procedure what they used to do manually. So I got the procedure done yesterday, and I'm feeling pretty good. So a big part of why I think I feel good today is because I did a lot of prehabbing, which isn't really discussed. But after my meniscus surgery in December, I went to the Howard Head Sports Medicine Clinic in Vail, and they gave me an amazing recovery regimen for the meniscus surgery. And through them and Maddie Haig, who's assistant with Dr. Preventure, really had me thinking differently about my knees. I think everybody thinks, oh, well, your knees, you strengthen your knees a little. How can you strengthen your knees? Maybe I do a couple exercises. But what really changed me is how they said the knee is part of a system. Your legs are really the system. And you have to strengthen your entire legs from your ankles all the way up through your hips. And the stronger you make all those muscles, the less forces you're going to have on your knees, and the better you're going to feel. And that just changed my thinking entirely. So it's like almost thinking about it like from mountain biking or suspension. You want to have active suspension. You want your legs to be active. So instead of all the forces, if you're thinking about snowboarding or whatever, going directly into your knees because you have your legs all locked up, you want to be very fluid. To do that, you've got to strengthen all these muscles throughout your legs. So they put me on an amazing program for rehabbing my meniscus. During that time period, I kind of just kept that going right up until this surgery. And we changed it from a rehab to a prehab. And basically, feeling like super, super strong going into the surgery, which I think has really helped me today being, just one day after.